I'm Peter Block at TCT 2018, and one of the questions that's bothered us for years and is finally or perhaps answered here at TCT is whether a bioabsorbable stent, or a BVS, is equal to, better than, or worse than, once again, a good old-fashioned drug-eluting stent with everolimus. So this is a trial, Absorb 4, which compared the bioabsorbable stent, Absorb, against the Xience stent. So the question is whether or not these two really are different, and whether or not that late resorption of the bioabsorbable stent is worthwhile compared to perhaps the early problems of greater bulk and so forth. The difference in this trial, Absorb 4, is that the investigators were all instructed to use larger vessels, prepare properly, et cetera, to try and make the BVS stent go as smoothly as possible. So let me tell you about the outcomes. The main outcome, of course, is target lesion failure at 30 days. That's sort of standard. There were 1,300 patients in each arm, sort of the standard things. And here's the issue. Acute success, 95% in the Absorb arm, but 99% in the Xience arm. That's a significant difference. Target lesion failure, slightly higher in the bioabsorbable arm and the BVS arm. Device thrombosis, 0.7% in the bioabsorbable versus 0.3% in the Xience arm. And recurrent angina, fortunately, no difference. So clinically, possibly no difference between the two. What do we take away from all this? Well, I've got two things that I think are probably the important things for you to remember. Number one, 30-day and 1-year adverse events still are greater with bioabsorbable stents. Number two, the technology still needs to be improved. We need to have better technology to make the late goodness that comes out of a bioabsorbable stent, the fact that it can be absorbed. We've got to get over the early problems to make that late goodness be worthwhile for our patients.